Dr. Kyle Lovelace here and Dr. Lonnie Bagwell. Good news is you're going to get to hear him lead the show today, not me. So first of all, this is Two Chiros. We're still looking for a name for this show that we're going to start doing every Tuesday. So if you guys have any ideas, share it with us. Other than that, we're going to talk about shoulder pain today. So Dr. Lonnie, let's do it.
Yeah, I was thinking about you said we were going to talk about shoulder pain, and sorry, I was on vacation last week and I couldn't get it worked out with being able to meet up. But
I'm sorry that you were on vacation too.
What's that?
I'm sorry that you were on vacation too.
I'm sorry I couldn't talk. I was happy to be on vacation. It was awesome. But one of the things is that I've been having shoulder pain, and so I thought that was amazing and ironic, and it really made me look a lot deeper as to how I was addressing my own shoulder pain. We try to ignore stuff. We want the pain to go away right away. But I had to do what I talked about last video. And, as always, I had to change my perspective. I had to change how I was looking at it. I had to ask better questions so that I could get better answers and take better action. And ultimately started working on some of the stuff that we're talking about today, as opposed to kind of the traditional approach to shoulder pain. So personal experience led us right into today's topic. When I learned about shoulder pain, I learned some basic things about the shoulder, where there's no joint that moves through a greater range of motion. And then when we talked about all the different things that can happen with the shoulder, I remember hearing, and it's probably plus or minus 1 or 2 phases, but that there was as many as 7 phases of shoulder degeneration. And I never forgot about that. So that when, because it could be from from adhesions that form in the joint capsule into tendonitis, into bursitis, into, some kind of rotator cuff issue, into all the way through frozen shoulder, is kind of where it ends when the shoulder basically just can't, is completely immobilized. And so I remember thinking like how complex that was, but in practice, and this is my experience, when people walk in with shoulder pain, it could be any one of those things, but if you get back to the cause and you get back to the basics, then it tends to alleviate no matter what label you put on it, no matter what piece of the tissue is causing the pain. If you get back to the basics, it seemed to alleviate it on a very consistent basis, which, started to make me look like I was the shoulder guru, but in reality, I was just applying the basics. So my first question for you was just kind of like, what are some of the primary causes of shoulder pain that you've seen walk through the door? I guess I want to talk about that a little bit first, and then I want to get back into, us versus them as far as how we'd approach shoulder issues.
Okay, cool. Yeah, man, same thing. I never was like, hey, I want to work on shoulders. I mean, obviously as an athlete growing up, I like the shoulder, the injury stuff is fun. My undergrad was in sports medicine, so I really enjoy that stuff, but it's not necessarily what I wanted to do every day. But yeah, when people come with shoulder problems, it's such a simple answer so many times that you don't have to go through injections and all these other things that the medical community usually puts them through. So when it comes to the cause of shoulder pain, one of the things that we look at that most doctors don't look at is we don't actually just look at the shoulder. A lot of times shoulder problems aren't actually shoulder problems. They're nerve problems coming from the lower part of your neck. The C5, C6 nerve root. I mean, that's what controls C4. That whole area controls this shoulder. And many times just the forward head posture being like this all the time, all the musculature out to here creates that pain in the shoulders. Now, when it comes to the shoulder joint, obviously you can have, labral tears, you can have rotator cuff tears, things like that. And that's going to be more of, hey, if you have a labrum tear, then we're going to need to keep as much movement in your joint as possible and do other protocols. But most shoulder pain is simply just inflammation in the joint. The joint's not moving properly, which rubs tendons, rubs ligaments, and you start feeling pain. And that's where things like bursitis comes in. Hey, if you've ever been diagnosed with bursitis, talking to people out there, if you've ever been diagnosed with bursitis, that is a kind of like one of those diagnoses where it's just like, I don't know what it is, so let's just call it bursitis. And you have bursa sacs, which are sacs that go underneath the tendons that connect to your muscles, to your bone. And when that rubs, those sacs can actually get inflamed. So the answer isn't get rid of the inflammation in the sac. The answer is, why is it getting inflamed? And typically that's a biomechanical issue in your shoulder, unless you just did something repetitive, like you've never shoveled dirt before and you just spent all day shoveling dirt. Right. And that can be a scenario. But typically the pain the patients that come in aren't like an acute, I did this thing, now my shoulder hurts. It's usually like, all of a sudden my shoulder started bothering me and it started doing this. And it's this chronic repetition of rubbing over that bursa, or the actual, AC joint being stressed over time from your shoulders constantly being rolled in from being on a mouse and computer typing and all that kind of stuff. Or sleeping on your shoulders is a big one too.
That was what I was going to say, is like so many people perceive like acute trauma as the cause, but that's rarely ever the case with shoulder issues that come through the door. I mean, it's maybe 1 in 100, but 99 are rooted in the mechanics. Interesting story about, because you actually led right into one of the things I wanted to talk about today, was you mentioned about mobilizing the joint, right? Yep. And so quick story, I was actually with one of the top physical therapists. It was a big name in physical therapy. And I drove down to Atlanta in order to be able to learn from him, how to better handle some of these extremity things, because we were working with Olympic weightlifters, Olympic wrestlers, CrossFitters, and all that. And I was like, well, I got to dive into this, because again, the purpose for which I exist is not to work on knees and shoulders, right? Yeah. And so I got to get better at this stuff. And so we went down there, and in a room of 100 people, this is so important, because everybody who I know that comes in with any kind of shoulder issues, you ask them what they were doing, they were icing and stretching. Whether they were told from a professional to do it, told from a YouTube video to do it, Dr. Google told them, whatever it was, but that's what they're doing. Here's the thing. Listen to the top physical therapist, 100 people in a room, not one person got the answer right to his question. And his question was, we have to first mobilize the joint before we can get into the soft tissue work. And specifically, and this is what I literally almost fell out of my chair, because he said, what we have to do first is to mobilize, make sure that the spine is actually moving the way that it's supposed to, because all peripheral motion stems back to movement of the primary structure, which is the spine, right?
Yeah.
And so then once you get that mobilized properly, and then I didn't have any other answers. I was in a room of physical therapists. I don't think like they think. And so they had all these crazy answers. He was like, wrong, wrong, wrong. And the only answer I had left in me was like, I guess I would work on the spine, because that's what I do. And sure enough, that's exactly what his answer was to the question. So, but the whole conversation here is about mobilizing. And I think people don't understand that there's a difference. And I watched him do this too to someone. So when he had everybody bend over and like try to touch their toes, see how far they could go. Mm-hmm. Then he had them stretch and try to go a little bit further. And you could see some little bit of improvement. Then later on, he said, everybody test yourself again. And then we did some mobilization exercises without any stretching at all. And people could literally put their palms on the floor. So most people watching this don't realize that you need to have proper joint motion before you work on all that tight, soft tissue.
Yeah,
right?
That's so big. Yeah,
that's
huge.
Tight, it's because the joints aren't moving right.
That, yeah. I'm really glad you said the spine, because so we talk about like the spine and the nerve root right there affecting the shoulder, but it's actually the movement of your spine, those muscles, it all connects, right? So those muscles connect. So if let's just say your shoulders rolled in like this, it's going to cause a neck problem. Or if you have a neck problem like this, well, now your shoulders are going to come in and roll in, and those biomechanics, the joints will actually lock up, right? I mean, they lock up on you. And then when we mobilize and adjust the joint, and that cavitation, many times that popping noise, when that happens, the patient's just like, it's almost like a pressure got taken, like you had like a, like this overpressure, you poked it and it was like,
absolutely.
Like, oh, that's the best feeling in the world, because it's been so locked up for so long. And then it doesn't take much usually with adjustments in shoulders and getting the joints moving, and then also getting the neck moving to get an actual relief. And that's why you would say, you became people would see you as a shoulder expert, is because you could get that relief so fast. Not necessarily fix the whole biomechanical issue and corrected the spine or anything else that fast, but you got the relief so fast because just that release, right, is enough to like, oh man, I feel like pressure just came out, right?
Exactly. It is pretty instant. And another story just popped in my head too. I was out in Colorado Springs for a competition. It was a hybrid USA weightlifting CrossFit competition. And ironically, I was all the way in Colorado Springs, but it was a competitor from Charlotte, North Carolina that was out there. And she came running over to the medical area where I was doing adjustments and stuff. And she goes, I need help quick. And she was really urgent. And of course, we turn our attention to her. She goes, I can't pick my arm up. Now, she was getting ready to do pull-ups and butterflies and, put 300 pounds over her head as a part of this competition. And she couldn't get her arm past parallel.
Yeah.
So she literally flew out there and was going to have zero chance of competing. everybody there, and the massage therapist that was there, the medical doctors, of course, what do they start doing? They start grabbing the shoulder, working the shoulder, trying to get it to move more. It wasn't moving, right? So as a point of last resort, which might be frustrating for us, but we recognize how the world perceives, you know, the hierarchy of medicine or whatever, she lets me adjust her. I didn't adjust the shoulder at all. I adjusted C5. And we know that the C5 nerve root goes out to control all the musculature. It's the everybody listening and watching this webinar, it's the neuromusculoskeletal system. We can't just camp out in musculoskeletal.
Yeah.
That's probably number one message of the day in every video, is that you can't just say, oh, I'm going to work on the musculoskeletal system and ignore the nerve part. So I adjusted her, and as fast as I adjusted her C5, she got up and she goes over to the pull-up bar and starts doing butterfly pull-ups again. And if anybody knows what that is, that's a gymnastic dynamic movement, putting a lot of stress in the shoulder, right? Yeah. Ultimately could do the whole competition, and I don't remember how she fared, but I mean, she went from 0 to competitor in 1 C5 adjustment for her shoulder. Now, I'm not saying this is not a promise of results for everybody, right? I feel like always that's a disclaimer, but that's the power of the innate ability to do what it's designed to do if you take away the interference.
So let me connect that for people. So that's your elite athlete, you know, you have the shoulder problem. So that's the frozen shoulder person, right? That's the person that when they lift, they can't get past here. And physical therapy will say, okay, that's scar tissue. We got to break up all of that scar tissue so you can get it here. But what it actually most of the time is your scapula doesn't get out of the way. So for her, I can just tell you what was going. I mean, that nerve root is part of the nervous system control of your scapula. So when your shoulder gets to here, now your scapula is supposed to move so you can keep going to here, right? So those nerves, C4, C5, that area, that spinal accessory and everything else, when we adjust, it actually now the scapula can get out of the way. So most shoulder problems, I work on the shoulder because it makes the person feel better, like we're addressing their symptom. But the results come from getting the spine moving, no question about that.
Yeah, there's a method to the madness.
Going in the shoulder gets out of the way and it moves again.
Yeah, there's a method to the madness, and what we do is just congruent with how the body works. Again, motion starts from the center. We start there. Yep. You get the mobilization at the central joints, the primary joints. It frees up the nervous system. I'm going to use the number that I'm going to say 80%. I don't know the exact number, but often 80% of the time, the shoulder resolves by the time you get to work on the shoulder.
Yep.
And then that's my personal experience.
And then you can do your PT stuff with not necessarily just the shoulder, but the neck. You can work on retraining the muscles in the spine, which is why that, if it's a chronic frozen shoulder, this isn't like we adjust the neck and all the frozen shoulder goes away. This is some repetitive stuff that you have to do, right? And so, hers is acute, but most people, it's this chronic thing that come in. So we adjust. You might see relief right away, you might not, but we're going to continue to do that. And while we're doing that, we're going to start to work on the structure, your ergonomics. So you're not like this on a computer all day. You start working on your posture, everything else. And then that actually lasts. And then, 3, 4, 5, some 6, 12, whatever visits it takes for your body now to start to get the nerve flow going. And because like that person it might not just be a subluxated spine, it might be a disc issue, right?
That's right.
That's going to take some time. We got a traction, we got to do other stuff to the neck. But the key is knowing that if you're here, we can't just look at the shoulder. If you have a shoulder problem, the only time I would say it's okay, just look at the shoulder is if you really had an acute labral tear, or you had, you're a baseball player, you literally threw your shoulder out or something like that, where we can see the tear, the MRI's there. It has to get repaired, or there has to go through some real rehab. But most people coming in with shoulder problems, that's not the case.
And I'll speak to one more group of people out there. So you have the acute trauma, and then you have the pure biomechanics, right? And then there is this chronic trauma. And I think a lot of people will fall into this category, and it is still a mechanical issue, but it's more of a repetitive stress trauma. So the classic example when it comes to shoulder is the lady that worked at I grew up in a small town, and there was a grocery store there. And of course it was the same person checking you out, just doing the same repetitive motion with every single item for everybody in the whole town for like 26 years. Ultimately, she gets shoulder issues, right? Because it's a repetitive stress trauma, right? So low-grade inflammation becomes this chronic inflammatory state, this degenerative state for the shoulder. And so that still falls under the category of bad mechanics, right? But there is a chronic stress and a chronic trauma that's happening there too. I would say I see that second most.
Yeah, the repetitive over and over again stuff. Yeah.
And I think Well, I was
let
to
me
say about
this.
kids too. Another category popped in my head too is like, because a lot of people say, well, my kids don't hurt. They don't have the chronic inflammation. They haven't been around long enough to be chronic anything, right? They're 13 or whatever it is. But we talk about the fires, right? It's like, just because you can't see it doesn't mean that it's not brewing, right? If a child is, if you have a child with a backpack on and their ears are 3 inches forward of their AC shoulder joint here, like we already had a problem 3 years ago.
Yep.
And now you're just waiting 3 more years for it to become this major issue at 15 years old or 20 years old or something, right? So this goes for everybody, because mechanics do rule across the board, no matter what age. Just we don't want to wait around until a symptom.
That's huge, and that's how we change generations, right? So you and I we're kind of like, I want to make you feel better. I want your shoulder to be better, but what I'd rather see is your whole life change and your your family's life change, and then the kids that your kids have see that whole change. So we change the country and the world, and that's not just a pipe dream. That's how it happens. Any good movement that changes something in the world, it starts with prevention. It starts with looking at the kids. So when we start to look at our kids, and you see, if you have a child with forward head posture or shoulders rolled in, you can almost see his future or her future 10, 15, 20 years down the road of being in pain, having to go to a chiropractor, having to go to a medical doctor, possible surgeries, possible disc issues, numbness, tingling in the hands, or even worse, that constant stress on the body creating nervous system problems that lead to organ issues. That can be heart arrhythmias. A lot of times will happen with this stuff, with the lower neck issues. So it's much bigger than shoulder pain. And that's why we're actually talking about shoulder pains, because we want to help people see is the shoulder pain is the side note. Most of the time, that's the easy fix. What we want to figure out is, okay, if you're having shoulder pain and it's more than, it's not just a labral tear or a rotator cuff tear. If it's more than that, then you also have other problems. You're also going to be dealing with other organ systems, because your nerves in your neck go to your low back go to your heart, your lungs, your digestive system, everything. It controls the entire body. So it's a nervous system problem, which means it's a health problem, right?
Absolutely. And I'll a moment of transparency. If I was frustrated at myself about my career or about my time, seeing patients and stuff like that, it would be that unfortunately I had to see that with my own eyes as a clinician, before I really started to speak the truth on that. Like, I would say like, oh, it's more than just a, mechanical spine issue. It's more than just that. But then when I started to see, the people adding medications, not for the pain that I was helping with, but for the organs that were impacted, right? Like when we were doing good work for them, but they were degenerating because we didn't tell them the truth fast enough, right? We didn't unfortunately, I had to wait to see it before I became passionate about seeing a life transformed through mobilization of the spine, clearing up of the nervous system, yes, helping with the pain, but more importantly, helping with their organ function, with their life function, their physiology. That would be the one thing I'd go back in time and tell my younger clinical self: don't be afraid to tell the whole truth about how deeply people are impacted by bad biomechanics.
Yeah, it's not only just being afraid. It takes a lot of effort. It takes a lot of energy to teach someone why this adjustment to your spine not only helps your shoulder, but it helps your heart. And I know it helps your heart because I have a patient right now that if she doesn't get adjusted once a week, she has a heart arrhythmias, like 70 years old, right? She's in her 70s. So she's had spinal degenerative changes that if it literally, it's a nerve issue. Heart arrhythmia is a nerve issue, right? So the other thing I wanted to say is for those of you that just like, wait, how does chiropractic and all this other stuff affect more than the shoulder? 90% of the stimulation to your brain, okay, we all know our brain controls everything. 90% of the stimulation to your brain comes from the movement of your spine. So if your spine's not moving, right, mobilized, we just talked about the chiropractic adjustment mobilizes your spine. If your spine's not moving, your brain's breaking down. It's slowly shutting down. And that's where I had a patient today, her second adjustment. So she just got her first adjustment Friday. It's the Thursday. She came in today, got her second adjustment, and she was like, I feel amazing. And I'm like, oh, well, that's one adjustment. Let's actually get started now. But she was like, I feel amazing. I just slept through the night. I slept like deeper than I've ever slept before. I feel like I'm digesting food better. I mean, she just went off. I'm like, wow, that's really cool, And I told her, I said, that's because we got movement into your spine, and your spine controls your brain. I'm sorry, I said that wrong. Your spine, movement of your spine is a big part of the stimulation and nutrients and mineral and everything else to your brain function. So her brain is actually working at a higher level again, which means you function better. So it's just pretty cool. So let's dive into, we went on a little bit of a tangent there. I want to pull back to the shoulder. So you had some questions like on, what would they do medically compared to chiropractically and stuff like that. So let's dive into.
Yeah, I think it's important in these videos that we always speak to where people are at, and most people are dealing, with some kind of medical approach, or they're self-medicating, over-the-counter medications, whatnot. And that was one of the things I was going to ask you, because I know you're really good at this stuff and you're better at this side than I am. But what are the most common treatments that you've seen that aren't working?
Mm-hmm.
Okay, for shoulder pain.
Yeah.
And speak a little bit to, I spoke about like stretching versus flexibility versus mobility. So flexibility versus mobility, but speak a little bit more to the traditional approach that we take as individuals over the counter, or that we would, if we go to the medical doctor, what are they going to tell us about the shoulder pain?
Yeah. Well, the first thing, that this is like your kind of the beginning starting point. Where you go to the doctor, you have shoulder pain, they do their evaluation. Really, no matter what they find, their first recommendation is going to be, we want to help you with that pain and the inflammation, right? So their first step is, okay, take ibuprofen, right? We get our ibuprofen. And actually, the truth is, we've probably already done that before you got to the doctor. So you have your non-steroidal anti-inflammatory drugs, and that's what we're trying to get rid of inflammation so that it just doesn't hurt as bad. Okay, maybe you took a painkiller like a Tylenol or something that helped small like that. So the problem with that is yes, it helps with the pain in the moment. Yes, it can help with inflammation, but we're not getting to the cause of what's actually creating the inflammation. That's one problem with it. The second problem with it is now we're actually altering other body functions, right? So the way ibuprofen or NSAIDs work is they actually affect what we call COX-2 inhibitors. So they actually affect a part of the digestive system and immune system, which then blocks inflammation. The problem there is now we're going to create digestive issues, right? And that's where they say NSAIDs, too many NSAIDs can cause ulcers. Well, because pathways in your body aren't just in one area. And the way medications work, even over-the-counter ones, is they either block a pathway or they excite a pathway. They inhibit it or they excite it. So it's going to affect other organs too. The FDA came out, I think, last year and said that non-steroidal anti-inflammatory drugs, so ibuprofen, Aleve, things like that, within the month that you take it, your chance of a heart attack goes up by 20%. I've heard anywhere from 20 to 40% based on the studies. So that's, when I hear that, I'm like, man, how many people all of a sudden had a heart attack, and it was because of the ibuprofen they took.
That's right.
And that sounds extreme, but that's actually what that's what these studies are showing. It even sounds extreme to me because I grew up with ibuprofens in the medicine cabinet in the bathroom, right? So it seems like when I say that, I'm like, no, but it's really what the studies have shown. And it makes sense too. And then the other one is, the Tylenol, which is the second leading cause, the leading cause of non-alcoholic fatty liver disease is taking Tylenol. And so you're saying, okay, I'm going to help with this pain. I'm going to take the Tylenol or the ibuprofen, which seems like fine for the moment, but what about tomorrow? What about the next day? So you keep taking those things. And now you come into our clinic where you're finally like, all right, I got to do something about it. And then now we start to work on it. We correct it, but now you have a liver problem because you took too many dang Tylenol, right? Yeah. And then the second thing they'll do, so now you go to the doctor and then they say, okay, let's do, and this is probably the quickest thing they do, is the steroid shot, the cortisone shot. So guys, just, cortisone is natural in our body. It's our body's really strongest anti-inflammatory. What they're using is a synthetic version of that to inject into the joint. If you go on the Mayo Clinic website and you just Google, you just put in cortisone shots, you can read about that. And one of the side effects or things they warn against is not doing too many of them because they actually cause breakdown of tissue. So they'll break down ligaments, they'll break down tendons, they'll break down the actual labrum and lead to an actual shoulder problem. So a patient that comes in to there that had a neck problem causing shoulder pain, which we talked about, they're going to get a steroid injection. And it might reduce that inflammation in that area. So you notice the change for anywhere from a week to 6 months. 6 months is as long as I've heard them feeling that result better. And then the problem is now you're susceptible to an actual shoulder injury. So that's a no-go. And it's also blocking your immune response as well. So that's bad. That's cortisone. Yeah, go ahead.
Well, I was going to say, you nailed it. First of all, let me just say that, like, you just crushed that explanation. That's right.
Nail on the hammer on the nail.
And in summary, with that,
I'm gonna start keeping a hammer. So whenever we nail it, I'm gonna slam it down.
That's okay. All right. So, but in summary, for everybody that's watching this, so basically, what to summarize what you just said is that yes, it can help reduce some of the pain symptomatology. However, it can slow tissue healing and or accelerate degradation of the joint itself and move people through the different problems of shoulder degeneration.
Yep.
So that in summary, right? So yes, you can feel better, but at what cost? That's really the ultimate.
You said it with bigger, more scientific words, though. I like that.
Well, you nailed it. I mean, you wrote a whole chapter on it right there. That was awesome.
Yeah. So then the next step is they're gonna say the cortisone shot doesn't work, and you come back in, and then eventually they're they'll send you to some PT, and we talked about why. Now, let me just say this: we're not saying PT doesn't work. We're saying that PT isn't the only answer for a shoulder problem.
That's right. I have a physical
therapist. Part of the answer. It's typically a part of the answer. Yeah, you have a PT that works in your clinic. I mean, we're not.
Right. Yeah,
we didn't mean that.
We love it. We don't want to, but it has to. But you can't put the cart before the horse.
Yeah. Yeah. And so then we get so then they're going to say, okay, the medications didn't work. So then they're going to typically your next route is they start doing scopes, surgeries, MRIs, all these other things, which is a huge pocket. I mean, it takes money, a lot of money to do that kind of stuff. And it's just a headache. When in 3 or 4 visits, many times shoulder problems can start to diminish. So so what I would say is from that, your first approach, and this is, I get it, we're chiropractors, so we're going to say your first approach is go to the chiropractor. But logically, your most conservative first approach, and based on the studies, based on just results, right? Your first approach is going to be go to a chiropractor, have your spine, your nervous system, and your shoulders evaluated, right, properly through a good, even X-rays, everything else, full evaluation plus X-rays, and then whatever they tell you from there, if they say, okay, we can fix this, you start working on it. And if you go through a series of care, whatever the recommendations might be, maybe it's a month, maybe it's 2 months, and you see no change whatsoever, then maybe we say, okay, let's go more in depth. Let's get an MRI. Let's see what your shoulder actually looks like, right? We've seen the structure with the X-rays. Now let's see what your shoulder looks like, because maybe there's something more in depth that we missed on some of your functional testing that we did, and we need to evaluate deeper. And then you do that. But that's like the 1%.
I was just going to say,
I can tell you in my career, 10 years now, I think I've sent out for 5 MRIs, 6 MRIs. Just very rare, because we can usually get through the problem before we have to go to an MRI.
Yeah, so. Right on. I'm 100% with you. Though our office would match those statistics, even though we've been around a little bit longer. There's no more, that we've had to refer out. And back to my generic number of, if you do things methodically from the foundation and work your way out, it clears up so much stuff. It's literally 80% resolved, and we never even have to get to the shoulder. But then, using your 1% number, then 19% of the time we may have to actually work more diligently on the shoulder. 1%, kind of refer out. Whatever the real numbers are, I think everybody gets the idea that there's a better approach. There's a more holistic approach that actually, and then the one thing we didn't really say, and I don't know if it needs to be said, but I'll say it, is that once this happens and you do it this way, you tend not to have more issues, right?
Yeah,
it doesn't come back.
Fixing biomechanics. Yeah.
That's it. Yeah. And everybody that's watching this right now, again, it almost doesn't need to be stated, but you take a pill, everybody knows that they're just leasing pain relief, but if people don't, you get an injection, you're just buying some time. You get a surgery, you're potentially creating more small fires as side effects of the surgery.
Potentially, you're definitely creating more.
Right, yeah, right, that's right. You're creating
scar tissue and everything, yeah.
And potentially throwing gas on the current fire, because, again, maybe we have a disproportionately higher percentage of people that come into us with shoulder issues who had bad surgeries, but there seems to be a lot of not great resolve going on, out there with that, my personal experience.
Let me share this too. So, treating with the medication, with any of that's the same thing, but the same thing with just taking turmeric to get rid of inflammation. That's a good idea, but why are you having inflammation? That's where our answer needs to be. The same thing with an adjustment. I'll say that, like if let's say you had a shoulder problem, we figured it was in your neck, you came in, we figured it all out, I adjusted you, shoulder pain went away, and said, okay, come back. So the problem with that is I got movement into your spine, but how did your spine get like that in the first place? And it was years of sitting at a computer, or years as a chiropractor. Like, we're not immune to this. Our head's down all the time adjusting people. So years as a chiropractor now affected your shoulder. And if I just adjusted it and said, okay, cool, you're good, pain's away, high five doc, referrals, you send everybody in, right? But then a month from now, your shoulder pain comes back and you go, that didn't work. It's because we actually didn't correct biomechanics there. We just got motion into your spine. So motion is the first step. The second step is now we need to actually look at the muscle, look at that PT board, look at the muscles and say, okay, now let's retrain your body, continual adjustments to keep it moving, give it an opportunity to reset. And then we go through spinal correction, which is, some neuromuscular stuff, different weighting systems and things like that, traction things that you can do at home and at the office. And then what will happen is now you go from this person that's like this, an injury waiting to happen, a pain problem waiting to happen, to someone like this. And now I'm just going to do this on the side, but now your weight of gravity goes evenly throughout your entire spine. So you don't have one specific joint that's taking all the weight. It goes evenly throughout your spine, which is how our spines were meant to handle the gravity. And you don't end up with disc herniations in that point. When you have a good curve in your neck, your mid back and your low back, you don't get disc herniations from everyday life. Maybe from a major car accident, but not from everyday life, right? Because it's this really sound, strong structure. So it's not a protocol, but it's a process to go through to actually retrain the body. And that could take, honestly, retrain the body is like a 12 to 18 month process in terms of, according to the physiology books, right? It's like a 12, 18 month retrain system. So a care plan for someone like that is shorter because we want to get good change, see stuff happen on x-rays, get good range of motion, symptoms gone. But then that patient still has to continue all their stuff at home. They'll come to us less often, but they still have to keep doing the retraining the muscles, because as soon as they stop that immediately after 2 to 3 months, right, then they're going to have to, it's going to revert back.
That's right.
So this isn't, we make it sound simple, but it isn't an overnight fix either. It's a long-term result takes retraining your body, which it took years to train it one way. It's going to take some time to retrain it.
Yeah, that's right. That patient, in Colorado Springs or whatever, obviously she had a long road ahead of her for that to never happen again, right?
Yeah.
I was just sitting there thinking, I almost laughed out loud because, like, I would say, I want to ask you, but I'll just say it. The number one thing that I hear when I'm doing consultation is, we'll say, do you have headaches? Do you have neck pain? Do you have mid back pain, low back pain? We'll go through the whole thing, and they'll say, well, I carry my stress in my shoulders.
Yeah.
So I almost want to call this video like stress in your shoulders, like watch this video, because we just answered that age-old explanation. There's no such thing as carrying your stress in your shoulders.
Yeah.
Your stress goes to wherever the biomechanics are failing.
Where the problem is, right?
That's the textbook explanation.
Wherever you feel. Some people get headaches from it. Some people get back pain. Most of us get this because most of us are like this.
Exactly. That's it. And literally it's statistics is what it is. But this ominous, so many people take over-the-counter medications because they carry their stress in their shoulders, which isn't even a thing. So this is the answer to that today. So very cool.
That's huge. Cool. So just as a whole, we did a real poor job of introducing everything this video. So Dr. Lonnie is up in Huntersville, Charlotte at True Health Center in Huntersville off exit 23?
23, Gilead Road.
Exit 23 up there. And then we're just down in Matthews in South Park. This is what we do in our clinics all day. This is kind of how him and I go back and forth all day long and share stories and stuff. So we just thought we'd start shooting videos on it and see if you guys could get anything out of it. So is there anything else you wanted to share on shoulder stuff? Or you feel like
I don't think so, man. But I was going to put you on the spot on purpose and say, what are we talking about next week?
Oh, what are we talking about next week?
Yeah. What do you want to talk about?
Let's talk about, actually, this is great. So if you're a mom listening right now, please get on next week. We're going to talk about ear infections. I know that seems like really specific, but we can go down a bunch of fun rabbit holes with ear infections because it's rarely an ear problem, right? We always go to the ear and inject or pump it full of antibiotics, but it's not an ear problem. So yeah, we're going to talk about ear infections. I don't think we've talked about that yet, so that's a good one. But yeah, hey guys, if something on this video, if you got something out of it, please share it. People really need to understand that there is a natural approach. There's a more effective approach where we're going, you can see this as holistic. I don't see a shoulder as a shoulder. I see a shoulder as a part of your body. So we need to evaluate your whole body and see why you're having a shoulder problem and then address it from there. So to get in contact with us, simply go to queencityhealthcenter.com or truehealthcenter.com. Is that right?
Truehealthcharlotte.com.
Truehealthcharlotte.com. And you connect with us if you want help with your health. Schedule an appointment time to see one of us. You can message us as well. And ultimately, guys, we're here to help you change the way you view and manage, not just view, but and manage your health. So we want you to actually act on this stuff because you becoming your own health expert is what's actually going to get you success in your health, not just taking what we say or taking what everyone else says, but actually owning your health. That's huge. Cool.
Awesome.
All right. Well, peace out. You guys have an awesome day. We'll talk to you next time.
Sounds good. See you next week.